Our customers in this market are small business owners. They wear lots of hats and they don't have time for complications, so when they come on to Paychecks to have us take work away from them and take over their payroll, they want to come on quickly, efficiently, and accurately with little effort on their part. We addressed our payroll onboarding process for clients with 0 to 50 employees. In our traditional payroll model, we had a single person assigned to support a sales rep. And so that person's workload would vary based on the sales cycle. And payroll is a cyclical business, so we would have times where the implementation specialist would be buried and other times when it was lighter. And so we changed that model to assign the work in a more even way so that the work was more evenly balanced and it gave people more breathing room to focus, concentrate, and give a better client experience.
Everybody, for the most part, knows Holy Sepulchre Cemetery. We have over 250,000 people buried in the cemetery. But one of the things that I didn't feel that we were doing as well when I came into the role of CEO was to be engaging with the community. Our mission is to provide a sacred final resting place and a Christian burial for those seeking it, primarily in the Catholic Church. And as a result, we need to be engaged with the community. So we started sponsoring different events within the community, primarily Catholic organizations, things like galas or different events that the organizations were holding, even high school plays. And that's actually expanded into hosting additional events at the cemetery, but really engaging and connecting more closely with the community. The real connection is to make the cemetery a place that people don't fear, but really that they come to celebrate life, and that's why it was really important to us.
Our constituents were feeling a difference. They were not getting the high quality service that we wanted to deliver to them. And constituents are, our employer groups, our individuals, members, customers, and providers. So we really felt that in order to address their needs, we needed to improve. We had gone through what we call a business transformation initiative, and that initiative was taking 7 legacy platforms and really integrating them into one platform. We did have a quality office which we basically leveraged to lead this initiative and help drive throughout the organization how we were going to improve quality and meet our performance standards. In addition, we took areas like my area, which is the operational area, and we named it Operational Excellence. So it wasn't just operations, now what are we striving for in the future?
Our improvements were all about teaching the faculty and staff what it meant to do performance improvement. Our goal was to have every level of the organization familiar with identifying waste and able to take some actions against it. We recognized that there was a need within the organization to build up a culture of continuous improvement. There wasn't a specific project or a specific need that we were trying to address, but more trying to empower the staff and faculty at all levels to be able to identify and address improvement opportunities wherever and whenever they came up. There's so many changes that are happening in healthcare right now. We're undergoing a shift in pay for performance, which takes into account not only quality and safety measures, but also patient evaluations of the services that they're receiving. At the same time, there's extreme pressure from technological changes that are happening. So we expanded the teaching and practicing opportunities for different people throughout the organization so that we could build up what we call a pyramid of competency, where each level of the organization can look to another level to provide support in their improvement efforts.
A lot of people in around Rochester haven't heard of Oldcastle, but we're actually the largest building material company in North America. As time has gone on, especially over the past 10 to 20 years, we've found it more and more difficult to be able to identify people that are qualified to be able to drive our trucks. So if you think about our business, we're very dependent on getting people that have CDL credential, because if we're not moving product, we don't have a business. Being in the building material distribution and manufacturing, we have to be able to get it from the manufacturing plants and the distribution facilities out to the job site. That's the entire business. The dominant age of a CDL driver in 1994 was between 25 and 29 years old, where 30% of the CDL drivers across the country were in that age bracket. Now, the age bracket is in the 40s, meaning that there's not a lot of new people going into this trade, and it's causing a strain on supply a lot of the managers that were responsible for interviewing and reviewing the applicants weren't reviewing these applicants for 2 to 3 weeks. And anybody knows that within this type of population where the demand is high and the supply is low, if you wait 2 to 3 weeks to be able to reach out to an applicant, they're going to be gone. We proposed to the CEO of Allied as well as the operations leaders that maybe we could hire somebody to be able to come on board and be responsible for not only sourcing and advertising for CDL drivers across the country, but also being the first point of contact with all of the CDL drivers that apply for positions no matter where they are in the country. We could have just sat back and said, we can't find CDL drivers, we need to just advertise more. You advertise more, you're going to get more, get more applicants, and then you're going to be able to do something with those applicants. And that wasn't necessarily the case.
We actually took on the improvement opportunity of really looking at our turnover rate in 2 different ways, both overall for the agency as well as specific to our direct care staff, which are the staff that work most closely frontline with our youth. In looking at turnover, there's a couple factors with that. One, if people are leaving the organization, are they not satisfied? Are they not getting the development that they're looking for? But sustainability in staff really makes a big impact on our youth. So staff leaving that work closely with them is another loss for our kids. We started really paying attention to what are the key competencies for each of the positions and built that into both the job description but also the interview that happens with the candidates. And we trained all of our managers in behavior-based interviewing so that we could, on the front end, do a better job in our hiring process.
We're a resident, which is sort of an overnight camp located on Canisius Lake. Been around, this is our 90th summer. So started in 1926. We serve mostly kids from Monroe County, Livingston County, Ontario County, mostly from the Diocese of Rochester. Summer camp is, for the campers, it's about fun and a sort of unstructured atmosphere for them, and we try to maintain that. On the back end of it, though, on the operation side, it needs to have processes that are very precise. In any given week in the summer, we have about 280 kids in our overnight camp, plus another 30 in our leadership program, which is also an overnight program, and then 50 kids in our day camp program. So around 350 kids each week. We had done enough work with the Quality Council that I met with some folks there and thought that it would be good for somebody on our staff, myself, to get their green belt. So I actually attended the Hillside program over at Hillside Family of Agencies and earned my green belt in 2014. And my project was to improve our swim test. So all the kids on Sunday, all those same 300 kids have to be swim tested. And so we wanted to ensure the accuracy and safety and timing of that.
Our outpatient program provides clinical appointments for clients, youth who come to our various outpatient clinics that are located across this geographical area. Scottsville Road, East Main Street, Penn Yan, Hilton, and there are a couple of other satellite offices. This team worked on aiming to reduce the number of discrepancies between how many appointments, outpatient appointments were held, services were delivered, and how many were actually entered or submitted for billing. We were delivering services to clients, but not processing the paperwork in a way so that we were not getting paid. Kelly Wilmot was the team leader. She formed a team and tried to understand the current state. Why were we having 22% discrepancies? They mapped out the current state, did some root cause analysis, identified a future state. They did a pilot and drove improvement, resulting in 6.7% discrepancies. That was at the end of their project.
DTRIP is a federally funded program aimed at improving healthcare quality and outcomes while reducing cost for the Medicaid and uninsured population. So the opportunity we were trying to get our arms around was, how do we really lead the transformational change that needs to happen across such a large organization like Rochester Regional Health, which includes 5 hospital systems, hundreds of physicians as well as our community-based organizations and partners. We developed teams for each of those projects that included executive sponsorship, a number of subject matter experts, and then the unique thing we did was really pair our team or operational leads with project managers who had strong project management and quality skills. It really does take a very collaborative organization to be involved with this transformational change, and the combination of our operational leaders and our project managers and the quality tools that they can leverage together are really driving this change and enabling us to hit our first-year goals, and also are setting us up to deliver our second-year goals and ensure that the changes that we make are sustainable over time.
The improvement opportunity was really minimizing the use of blood transfusions when they were unnecessary, trying to make sure that when those things were truly required, they were available, but it wasn't a first option that was being utilized. Blood transfusions have previously been thought of as rather benign interventions, but data more recently has shown that a blood transfusion really should be considered to be a liquid organ transplant and considered with the same level of scrutiny and decision making that other organ transplants use. I think the most important thing in this improvement was the tenacity of the team. Repeated communication, repeated education, and the emphasis on the data that really supports this change, providing better quality care for our patients. This is an example where less is more for the patients, and it's a win-win overall.
Our customers depend on our products to help them with medical research and bioproduction, and when they don't have our products, that can interrupt their production flow and potentially impact the availability of medicines or therapies for global customers. We found that our scheduling was misaligned with our customer demand. So we put processes in place and did some analytics to help us optimize our scheduling, our sequencing, as well as improve our operational efficiencies through problem solving and continuous improvement to bridge the gap between our scheduling and our customer demand. We've seen significant improvements in quality, focus, responsiveness, scrap reduction, cost reduction. All that focus has yielded a tremendous return on investment for our leadership and our people development.
Facility serves our entire agency, and it's important to have the service requests completed in a timely fashion for the satisfaction of the staff who work there and the youth and family that we serve. We did a customer satisfaction survey. This actually was of the staff who worked there. And this team took a look at the satisfaction and found some opportunities with the timeliness and with the response rate of completing projects on time. This was a Greenbelt certification project that Deb Kohler led. She formed a team, and that team followed the define, measure, analyze, improve, and control process. They set a goal to get to 85% complete. They mapped out the current state, did root cause analysis, they identified improvements, they piloted, they implemented those improvements, and they reached 87% completed within time at the conclusion of the project.
At Butler Till, we were faced with a challenge from our client to come up with a national level advertising program that would be broken down to the individual agent level. The client is an insurance company, so the agent is the actual person working for that company. They hire us to help drive business and awareness for their individual location. Across all of the participating agents, we had to process nearly 80,000 pieces of creative. So that meant looking up their individual agent code, their name, inputting that into a new file name. What we would have had to do was manually type in all of the agent's information into the file name. So that would have taken about 1.5 to 2 minutes per file name to make sure all the information is there. And it went from about 90 seconds, you could say, to about 20 seconds total to create the document.
The Gastroenterology Department is focused on the gastrointestinal tract of the body, and one of the services that they provide is screening colonoscopies to ensure that people, if they are at risk or potentially have colon cancer, that is identified as early as possible so patients can have access to treatment. The improvement opportunity was really twofold. On one side, we wanted to increase the patient's access to care, and on the other side, we wanted to reduce the no-show rates, the time that was being wasted when we could be providing care for patients. The team really focused on understanding what was causing patients to not show up for their appointment. And what was found was that a lot of times patients were unsure of how to prepare for the treatment. And if the preparation wasn't done, the patient could not come in for the screening colonoscopy. In this age of a lot of electronic communication and automated phone calls and the like, it's easy to think that that is actually reaching the people that you need to contact. In this case, people really needed to reach a live person so that they could ask their questions and have their fears allayed so that they would be ready to come in for the procedure.
Rochester Ambulatory Surgery Center is an ambulatory surgery center that specializes in performing outpatient surgery. We started to see a trend in our supply cost going up, and felt that it was necessary to put together a plan to address that upward trend. We're talking about surgical supplies primarily, so anything from gowns, gloves, simple things like that, to IV tubing and more complex supplies like implants. The most important thing that we've learned from this is how important it is to engage your staff. You know, it can't be a problem where 2 or 3 people are trying to change the organization. It has to be 2 or 3 people can motivate and engage others, which kind of cascades into a situation where everyone is aligned and working toward the same goal.